welcome back. You're listening to Smooth 98.1 at Love Music, Love Life. It is a smooth drive, and it's time for the Smooth Health on the Drive, and is of course brought to you by Evercare Hospital.
That's right. If you just joined us for the first time, you are just in luck. Today we're going to be talking about the state of critical care in Nigeria and the way forward. And we have a very, very special guest to speak with us, to us on this situation. His name is Dr. Victor Raji. Good afternoon, sir.
Good afternoon.
Good afternoon, sir. Say it again one more time.
Good afternoon.
There you are.
So
It's good to have you. Thank you so much for joining us today.
Dr. Raji Anyowale Victor has extensive experience in critical care practicing as an help me with the word, sir.
Intensivist,
IC coordinator and director. His core specialties are in critical care medicine,
obstetric,
yes, and neuro anesthesia and pediatric anesthesia. Now, he's also a certified senior flight physician and trainer of trainers. I like that word, trainer of trainers in pre-hospital care. Now, he's routinely exposed to the best practices, working with some of the best surgeons and anesthetics/critical care physicians in the world. And he also attended several workshops and trainings in critical care principles and practice of anesthesia and air ambulance skyward intensive care unit, with greater than 10,000 hours flight time to South Africa, the UK, India, the Middle East, and North America. Wow.
And with that resume, you can tell that he's the best person to have this conversation with, because today we're talking about the state of critical care in Nigeria and the way forward. So with that resume, you can tell that Dr. Victor Raji is the best person to do that. So, sir, from your resume, clearly you've attended several workshops and training in critical care. But what is critical care? Because you're the best person to answer the question. And when is it needed for patients?
Yeah, thank you very much. I'm very happy to be here today.
Thank you for coming.
Critical care, it's a very new field in Nigeria, but critical care is a care that is specialized for patients that need more than the third level of care. That means the patients that have had what can I call it, a failed organ system, or more failed organ system, or a patient that is potentially going to fail an organ system. So they need specialized care, specialized nursing, specialized monitoring, specialized equipment, and specialized everything. Thank you very much.
Everything that's specialized. Well, it's a good thing that we're talking about the state of critical care, though. And Lagos, if you're out there and you've got questions, right, you want to, ask him questions about this that we're discussing today, please reach out to us on 0809 444 0981. Better yet, please call us on 0144899981. Dr. Raji, generally, you've talked about, all the types of care that people might need. So let's talk about the challenges of critical care in Nigeria. I know that we have, let's even start with NEPA. Let's not start with the basic stuff. What are the critical, challenges that, critical care faces in Nigeria?
Okay, thank you very much. The pandemic actually really highlighted a lot of challenges that we face in Nigeria concerning critical care. How will I start from? Or where should I start from? The infrastructures are not there. Where we have to, like in Lagos now, we have up to 13 to 15 million people jam-packed into a space, and the critical bed available is under 200.
Wow.
So we're having a ratio of 0.000001 bed per head. So we are grossly out of grossly inadequately equipped.
Is this across board though, or is it just for government hospitals, or generally across board?
Across board. So then the training, there's no structured training for critical care in Nigeria. What I mean by structured training is that if you go to a postgraduate school now, we have a school of faculty of anesthesia, but there's no faculty of critical care. Both in the West African College of Medicine and National College of medicine, which trains the specialists.
Oh, wow.
So most of us we have to go out to get more training as a sub-specialty training in critical care. So that's one. Two. That thirdly, the concept of critical care is not very clear, and the policies for critical care in Nigeria is grossly inadequate. So there is no coordinated, well-stated blueprint that is clear to say this is where we're going to be in critical care this year, and in the short term, in the next 3 years, this is where critical care is going to be, and there's like in the long term, 10 years, 20 years, there's no plan for that.
Oh, wow.
And then the concept that the concept is very, very new to many people. People believe that critical care is a place to go and die, but actually critical care is a place to go and to be revived in a way, if I have to say use that word, because most of the conditions that people we have are potentially recoverable, even though they are multi-systemic, but they can be reversed.
Nice.
Thank you.
Nice. But in what ways is Evercare, because we'll definitely have to center Evercare in all of this, but in what ways is Evercare supporting and changing the dynamics of critical care in Nigeria, and all that you shared concerning the problems that we're facing?
Okay, first and foremost, Evercare has provided the enabling environment, the playing ground, that's infrastructure that is world class, that is populated with world class equipment, critical care equipment, both diagnostic, that's for investigation, and therapeutic, that's for treatment. Then they've gone all over the world to recruit the best brains to come back to Nigeria to help run this unit. The intensive care unit in Evercare is actually a level 5 ICU. Most of the ICUs that we have in Nigeria before level 2 or level 3. What do I mean by level 5? We do very specialized management of patients, even providing a continuous dialysis for a patient in that unit without being moved to anywhere. We can radio image any patient within that facility without moving a very critically ill patient, because many patients that are critically ill are actually lost in transit. From going from one place, like there'll be patients need dialysis, that is to clean the clinic, and they have to move like 10, 20 kilometers to another facility that can offer that.
Yeah.
Or even really like what they call CT scan, like a computerized scanning. They might not be able to get it on that facility. They have to go to another facility that is very far, and there's Lagos traffic. There's no helicopters that can just so. But everything is under the roof of Evercare, and Evercare is also having this concept of what they call patient-centered care.
What does that mean, sir?
Okay, patient-centered care is that every activity is targeted towards the comfort and well-being of the patient. We are not like the doctor is number one in all this, or the nurse is the focus, is the patient.
Okay.
So there's nothing like GOC, General Officer Commanding Staff. It is more of a teamwork. So we win together, we play together, and we do it together. That's what we do in Evercare. So we bring this, what they call Evercare culture. This Evercare culture is a new concept. There's no friction, there's no superior, and there's no inferior in Evercare. From the gateman, sorry for saying gateman, from the security at the door.
It's okay, we understand. We're Nigerians.
The security at the door to the CEO, and then to the COO, West Africa, and even the worldwide CEO and president and chairman. Everybody, we call ourselves by first name. And we move together. Everybody, what I know, they know. So there's standardized care with standard operating procedures, clinical pathways, that we look at the patient as a holistic person from entering to the gate to discharge, and even further by following up by telemedicine. Thank you.
All right.
Oh, wonderful stuff there.
If you just joined us and, you've missed out on a few things we've discussed. We're talking about the state of critical care in Nigeria. And, of course, this is the Smooth Health Show. It's brought to you by Evercare Hospital. It's Judith and Coyote. And you can also be a part of the conversation. Please send your questions into 0809 444 0981.
Yes, indeed.
Dr. Raji.
Yep.
We were also talking about, still talking about critical care. Let's talk about the intensive care unit of Evercare Hospital. So, I mean, in layman's terms, what does that mean, and how does that work, and who needs to be there? You know, what goes on there, and how does what role does Evercare play with all of that combined?
Okay, so anytime I'm asked this question, I always say that just walk into a hospital, you will generally understand what is intensive care unit. Firstly, that's what they call first level of care. That is the normal care you have on the ward. Second level of care is a care that you have more monitoring. That's we have one nurse to like 2 patients. But the third level of care is intensive care units. That is where you have 1-to-1 nursing ratio. Why am I saying nursing ratio? Nurses are actually the lead of critical care because they are with the patient, they observe the patient, they know everything about the patient, and they call on the doctor immediately to take care. So now, intensive care unit is a, let me say, geographical area in the hospital that is set aside for the care of critically ill patients from level 2 up to level 5. So what are these things that they are there? They are specialized equipment. So that is what they call multi-parameter monitors. That they have multi-parameters are different parameters to monitor at the same time. I can measure people, monitor somebody's blood pressure in real time, somebody's heart rate in real time, somebody's oxygen level in real time, somebody's ECG in real time. ECG means electric activity of the heart of a patient.
Okay.
In real time. And I might even go further by even go invasive. I can put something in the patient's artery to even know the patient's blood pressure bit by bit, not minute by minute or 15 minutes time.
Okay.
Like as the heart beats.
At every beat.
At every beat, I know the patient's blood pressure. And I also know from the graph that is coming, is the patient have enough fluid in his body? Is the patient having some form of heart failure? Is the patient having some other things that could make the patient die if not well monitored? Then what about therapeutics? So that the drugs, there are specialized drugs that you can give in the ICU that you cannot give in other parts in the hospital because they need that patient to be constantly monitored, so there will not be any adverse event. Then issue of infection control. ICU is a place that you have to really control infections because most of the patients are like they are very sick, so their immunity is not not at par with like normal people. So infection control policies, and again, workflow in the ICU can be sometimes chaotic. So you need a very good manager and director that is well trained to coordinate all the activities and also get data that can be used to improve quality and type of care in that place through research and audit. Thank you.
All right.
Wonderful there. If you just joined us, we have Dr. Victor Raji from the Evercare Hospital, Lekki. He's here to talk to us about the state of critical care in Nigeria and the way forward. Remember that if you have any questions for our doctor here in the studio, you can go ahead and send us a WhatsApp message to 0809 444 0981. Again, 0809 444 0981. You can also call us up with your questions at all. Any questions you have concerning critical care in Nigeria, the way forward, or even about Evercare Hospital, he's the best person to talk to. So call us up on 01 448 9981. Again, 01 448 9981. We'll go for a very short break. When we come back on the other side, we're going to go on with this interview. Stay with us.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
It's another season of the biggest show on TV, and we're here for all of it. We love the drama.
The emblem on my neck signifies authority.
The suspense. The buzz.
Why did you say that? You have no right to say that. I said don't touch me.
And of course, we love the refreshment. Enjoy every moment of the season with a cold, refreshing bottle of Pepsi.
Pepsi, for the love of excitement. Pepsi, for the love of it.
Smooth health on the drive.
So Lagos, if you didn't know, now you know.
Stay tuned.
Welcome back. You're listening to Smooth 98.1. Love music, love life. It is a smooth drive right here on the show. My name is Judith TV.
I'm Kaide Baker.
And of course, the Smooth Drive is brought to you. Smooth Health is brought to you by Evercare Hospital, Lekki. They're transforming healthcare as we know it in Nigeria. And to do that today, we have Dr. Victor Raji. He's joining us live in the studio to talk to us about the state of critical health, critical care in Nigeria, and of course, the way forward.
That's right. Okay, so let's talk about, effects generally. So don't forget, we see messages already. Don't forget, we're giving out vouchers on the show today. So courtesy Evercare Hospital, but let's take the first call.
Hello? Oh, we lost you there. Call us up on 014489981. Again, 014489981. We have a message here. Let's see who this is, although you didn't leave your name, though, you just go, good evening, Dr. Victor. Please, I'd like to know if a patient suffering from systemic lymphocytosis, I hope I got that correctly, qualifies to be in the ICU.
That word. Hello?
Okay, systemic lupus erythematosus. Okay, SLE for short.
Yeah, we're with you. How you doing,
You're
sir?
with you, sir.
Okay, I would like to be anonymous.
Yes, sir. Go ahead, sir.
I am actually very glad that I heard the Dr. Raji specifically talk about so many wonderful things in terms of services by Evercare, but I'm not sure that is correct. And this is me not embarrassing him, but I can tell you my experience with the hospital. I happen to have a critical condition, and a patient was moved into the facility exactly on the 13th of August. And the patient was moved in an ambulance, carried all the way from Ogun State, on recommendation of Evercare, on the recommendation that Evercare is fit for the purpose. We got there in the middle of the night, around 2 a.m., to meet a doctor who rejected the patient. It was so embarrassing to the extent that there was no plea that we did not make that night.
Hello, sir. What's your name again, sir?
He said he would like to remain anonymous.
I will use my name, but if you don't mind, I can come personally into the office, into your hospital.
Yes, would like that,
Would
please.
love that.
Would love
As
that
opposed
too.
to putting that out.
You know what? We had to move the patient to a far less smaller hospital. And the patient was managed. The patient is hale and healthy now.
Okay.
So all this I'm hearing from the doctor is news to me.
All right, sir. Tell me what we should do.
But we need to differentiate that. This is what you're explaining now is intensive care. Is the ICU. What we are talking about is critical care. So that's intensive care, okay? But I would prefer for you to please go to the hospital and, of course, take all of these complaints to them. There's a reception in
the management. Like I said, I don't mean to embarrass.
Well, I mean, it's already been done. But thank you so much. Thank you for your call there. Appreciate you.
Dr. Raji, you want to respond to that?
Yeah, actually, I have to thank the gentleman, though I don't know his name. For you to say a lot of things I say is not correct. It is a rhetoric. It's a rhetoric situation. But what I know from the little he said, he didn't give us too much detail. Is that a patient came in without referral, just walked in, and the doctor most likely is the first line of management decided that the patient needs to see another person somewhere else. So it's not all the patients that come into Evercare based on what he said that that will be attended to but that patient, I assure you, was stabilized, was attended to in the ER, not in the critical care now.
Okay.
In ER, that is emergency room, which is a different department from critical care, and this policy is that the Lagos State policy that patient must be stabilized and then referred to to another place. And they did it, and I'm very sure there's this issue of some people come in with patients, and there's this issue of where they're discussing about financial, family, no family around, no that, and Evercare accepts all patients without payments. And we even spend the first, what can I call it, payments from our pocket to stabilize the patient, and sometimes they don't pay back and they go to another facility, and that's it. Thank you.
Well, speaking about different units here, and of course this question is from Silva. Silva was the one who asked about the SLE. I guess she's back again saying, what's the difference between critical care and intensive care? That's from Silva.
Okay. Critical care is all encompassing, which is more of like there are different levels of care. So I said level 2. Level 2 is what they call high dependency units. That is when an organ is threatening to fail, but you are trying to observe the patient closely, so that in case it fails, you can escalate care to intensive care, which is it starts from level 3 to level 4, level 5. Okay, so depending on what the patient would need. SLE is like a connective tissue disorder that usually affects women, and it's very devastating because it's a systemic thing. Everywhere is affected. So patients can have lung issues, can have kidney issues, heart issues, liver issues, eye issues, central nervous system issues. So anytime there's an organ that I've mentioned is about to fail, that patient should come to the ICU. But ultimately, there's no treatment for for SLE. But there is a lot of life-changing, disease-modifying
treatments.
Yes. So, if anybody rejects you in critical care because of SLE, please, that's not correct. Thank you.
All right, doctor. You know what,
doctor?
If you're out there and you've got more questions, like our first anonymous caller, you can also reach out to us, okay? And also, don't forget, we're giving out vouchers courtesy Evercare Hospital. So that is for your first consultation, first free consultation. So whether it's dentition or whether it's an intensive care checkup, whatever it is really, just reach out to the good people at Evercare. Once you send in your details, first 3 callers, first 3 texters will give you those vouchers. That said, doctor, you mentioned something about lifelong effects, right? So let's talk about, let me ask this question. Are there lifetime effects for critical care patients after leaving the hospital?
So, okay, let me just quickly answer that. Thank you very much. It depends on the patient's admitting condition. If the condition is very serious one, or a condition that has been that fits to what they call chronic. Chronic means something that will be there for more than 2 weeks.
Okay.
So some might come with some debilitation that will last long. Let me tell you something, like a patient with stroke.
Okay.
That is admitted into the ICU. After the critical care, maybe he was unconscious. So that's one of the indications for coming to the ICU. So we have indication for coming to the ICU. Okay? So it was managed, and he regained consciousness. You know that his stroke is still there. It usually might not be reversible.
Yes.
But it can be sent to what they call rehabilitative care.
Okay.
Whereby we have long-term physiotherapy, speech therapy, musicotherapy, and even some other therapies that might help him, and occupational therapy to readjust his lifetime. So what they call DALI, disability life years, will be there, but the quality life years will also be there. But you have to now balance quality and disability. So that disability will be there. So that's one of the long time. But some people, because of critical care, they might have to do some procedures.
Okay.
By putting some airway in some areas of the body, on the neck.
Okay.
So they might go there, call it tracheostomy. So they might go there they might be there for some time, and those ones have their own complications and the rest. So it might not be lifetime, but it might be with the patient for some time until the patient cannot be able to use his own normal airway to breathe. So there's other things that you can do in critical care that might have long-term effects. But the most important thing is, what is the condition that brought the patient to critical care, and how modifiable or curable that illness is. I don't know if I am making a...
Yes, absolutely. You are. We have more questions here. This is from WhatsApp. This is at Larry from Festac and goes, good evening all. Are doctors and Evercare not part of the ongoing strike by doctors? He's very interested to know.
Obviously no.
I think that's a rhetorical question.
I mean, that's really rhetorical. They are not employed under the government. So.
Please, we are here. We are there, live on ground, ready to accept and to treat everybody that we can. Please, you can come. I always tell people that it's not only when you are sick that you come to the hospital. Can come for
it's money now. It's money now. Speaking of doctor, talk to me about, besides just critical care, and which other specialists attend to critical care, and what is the approach to treatment at Evercare Hospital?
So this is one of the things I didn't talk about, maybe because I saw that maybe I saw that maybe this question will come up. Yes, is that it's a multidisciplinary approach. What do I mean by multidisciplinary approach of care? We have multiple specialists taking care of a patient simultaneously every time, following the patient up. If a patient comes in with a brain problem, we call a neurologist.
Okay.
And that patient might need respiratory care, so we call a respiratory physician. The patient might need the diet will be actually have to be looking to dietitian. The patient needs physiotherapy is there. The patient needs drugs, so clinical pharmacist is there.
Wow.
The patient needs to get their loads something by luggages has to be carried, so there's porter, and then the patient needs to be secure, so security bed, and then. Like me, I'm the chief security that open the door and close the door there. So I am there also. Thank you.
All right. Wow. It's what they say, time flies when you're having fun. But
yes,
we're almost
indeed.
wrap it up this side of the show. But it's important, Doctor. We'd like to know, I'm sure the good people out there in Lagos also would like to know where Evercare is located. But just before we answer, or I let you answer that question.
Yes, indeed. Please share with us, when it comes to, you have a lot of stories, and I'm sure you will, because from your resume, you've been doing this for a very long time. So please share with us some, critical care situations, because I know people are listening and be wondering, what kind of situations will be in the critical care unit. So please share with us some critical care situations you have encountered and the treatment options to resolving those cases.
Okay.
It's now feeling like what's that medical TV show that you'd see different
Grey's Anatomy?
Yeah, Grey's Anatomy.
Okay, so without talking shop, okay, so we have seen quite a number. But there was a striking one. A patient that had a CS and then had renal shutdown. That is kidney shut down, and then needed continuous renal replacement therapy. In a nutshell, CRRT. She lost a lot of blood and then was unconscious, and she was brought, and it was like hopeless case. And we started this. I always pray before I start working on my patients, so we continue the renal care. So modalities of treatment, renal care. Okay. That's clinical care. Then in conjunction with the nephrologist. Then we have to place the patient on mechanical ventilator, which is life support. This life support is not to make the heart beat, but actually to make sure the lungs can be aerated and the patient can have enough oxygen, and then they will not die, because if you don't put them on there, they cannot breathe by themselves, on their own. Okay, so with a lot of antibiotics, because if somebody they have CS, doesn't mean that it's only surgery. After sometimes the gut will get some issues, and then patient will start having infections. So we have to give a combination of good antibiotics.
Yeah.
Took a lot of samples, prayed, and let me tell you, by the second week, she woke up, and we were able to take her off the life support.
Wow.
Take her off the kidney washing, as I call it, washing of kidney, and all those toxins in her body. Urine she started making urine by herself.
Okay.
And then she started physiotherapy, and she was home in no time.
Wow.
And the other time, I was just going to immunize my baby in one of these children's hospital, and I was just hearing my name, Dr. Raji. I didn't even know. I just saw one beautiful lady with one small child. Sorry, you don't know me again? I said, Ma, I don't know you. I'm so sorry. I said, Doctor, you are the one that treated me in the ICU.
Yeah.
You are the one that only see when, as if there are some angels surrounding me, praying for me, and somebody always called Victor. And then that must be you. I say, oh, okay, my name is Victor Raji, actually. Then we are so grateful, God will bless you and everything. And that's one of the things I always hold on to, that no case is hopeless until you give up. So that's that. Then there are other cases that came in, both because of infection, because of heart failure, kidney failure, and in ICU, our ICU now, Evercare now. Let me give you a benchmark. Benchmark for good result. Actually, most ICU is 40 to 45%. That means if you come, 45% of people might make it out of the ICU, and the other part will not make it out of ICU. In our ICU in Evercare, for the past 6 months that we started, our benchmark is our own result is 96% good outcome. If you remove those other more stable cases and those very bad cases, is 88.6% good outcome. Why do we achieve this? As I told you, infrastructure, teamwork, multidisciplinary approach, patient care, centered care, involving the patient, their family in their treatment. They also have taken part and having a say in their management goes a long way. As I told you, when it comes to Evercare, our main thrust is to create what they call the wow effect.
Wow.
So anybody comes here,
wow. Everybody saying wow.
Amazing.
Doctor, it's been wonderful having you here. A big thank you to you there. But hey, how can they contact Evercare Hospital, by the way?
Okay. Evercare Hospital, we are right there at Lekki Phase 1. Okay, so first, Admiralty Way, Bisola Durosimi Etis Drive, Lekki Peninsula, Scheme 1, Lekki. Scheme 1, usually people call it Phase 1, Lekki, Lagos. Our website, you can also get us on www.evercare.ng. Our telephone number is 081 39 85 07 10. 081 39 85 07 10. You can also email us on info@evercare.ng.
All right. Thank you so much, Dr. Raji.
Thank you so much, Doctor, for that.
For those out there, its email is info@evercare.ng. Once again, the phone number is 081 39 85 0710. I'll say that slowly. 081 39 85 0710.